Hi guys! Welcome back to TFN 101.
And we are the Hildegard Peplau team.
So for today's presentation, we will talk about the interpersonal theory of Hildegard Peplau. So without further ado, let's get started. Shinel, ano yung presentation ko? Sige, send ko lang sa'yo. Mamaya. Sige, bye-bye. Okay, welcome. Hi guys, I'm Jan Angelo Embalyarta. I'm a nursing student in Palawan State University. In this video, we will talk about who is Hildegard Peplau. Hildegard Peplau was born in 1909 in Reading, Pennsylvania, and died in 1999. She's known as the mother of psychiatric nursing because of her theoretical and clinical work that led to the development of distinct specialty field in psychiatric of nursing. She's also known as a psychiatric nurse expert, educator, author, nursing leader, and theorist. In 1931, she graduated in Pottstown Hospital School of Nursing. Peplau earned her degree at Bachelor in Interpersonal Psychology in 1943. After 4 years later, in the year 1947, she got her Master of Art in Psychiatric Nursing. During 1950 to 1970s, she developed the first graduate program for clinical specialists and psychiatric nursing. Hildegard Peplau published a book entitled Interpersonal Relation in Nursing in 1952, which about this theory of interpersonal relations as it was relevant to the work of nurses. Now, we will talk about the interpersonal theory of Hildegard Peplau. It focuses on the therapeutic nurse-client relationship by using problem-solving techniques to meet the patient's needs. Also, this theory was greatly influenced by the interpersonal relationship theories of Freud, Maslow, and Solyapan, as well as by contemporaneous psychoanalytical model. Now, you know already who is Hildegard Peplau and his theory. That's all. Thank you.
The theory explained the purpose of nursing is to help others identify their health difficulties. Nurses should apply principles of human relation to the problems that arises at all levels. Nursing is an interpersonal process because it involves interaction between two or more individuals with a common goal. Nurse and patient work together so both become mature and knowledgeable in the process. The theory explained phase of interpersonal process, roles in nursing situation, and methods of studying nursing as an interpersonal process. The attainment of goal is achieved through the use of series of steps following a series of patterns. A professional and planned relationship between nurse and patient is focuses on needs, feelings, problems, and idea. It involves interaction of individual with a common goal. So a goal is achieved through a series of steps following a sequential pattern. So here are the 4 sequential phases. We have orientation, identification, exploitation, and resolution. So don't worry guys, this will be further explained by Shane later. Nurse as a stranger receives a patient in the same way in other life situations. The nurse should create environment that builds trust. Nurse as a teacher imparts knowledge in reference to the needs or interests of the patient. In that way, nurse is also a resource person, providing specific information needed by the patient that helps the patient understand the problem or situation. Nurse as a counselor helps the patient understand and integrate the meaning of current life situations, as well as create guidance and encouragement in order to make changes. As a surrogate, nurse acts as an advocate to the patient. As a leader, nurse helps the patient takes on maximum responsibility for meeting his or her treatment goals. And lastly, as a technical expert, nurse provides physical care and also operates equipment. Peplau believed that nurses can take many roles, but they are not defined in detail. She said they were left on the intelligence and imagination of the readers. So they're quite a lot, and it's just show that nurses are really amazing, right?
Hi guys! So now let's talk about Peplau's meta paradigm. So let's discuss about Hildegard Peplau's interpersonal theory's meta paradigm. She viewed the person as a developing organism that tries to reduce anxiety caused by needs. She viewed health as a word symbol that implies forward movement of personality and other human processes toward creative, constructive, productive, personal, and community living. She viewed the environment as an existing force outside of the person and put in the context of culture. And lastly, she viewed nursing as an educative instrument and a maturing force that aims to promote forward movement of personality in the direction of creative, constructive, productive, personal, and community living. And now let's talk about the application of Peplau's theory in nursing education, research, and practice. In Peplau's theory, she identifies the four sequential phases. The first phase is the orientation phase. This phase defines the problem. It starts when the nurse meets the patient and the two are strangers. After defining the problem, the orientation phase identifies the type of service needed by the patient. Essentially, the orientation phase is the nurse's assessment of the patient's health and situation.
Today. Can you state your name and date of birth for me?
It's Sammy Ronley, and it's 7/23/98.
Okay, perfect. What brings you in today?
I think I have the flu.
The flu? Okay. Is it okay if I do a quick health assessment on you?
Yeah.
Okay, if there's any concerns or questions or you're not comfortable with anything at all, just let me know at any time.
Okay, thank you.
The second phase is the identification phase. It includes the selection of the appropriate assistance by a professional. In this case, the patient begins to feel as if he or she belongs and feels capable of dealing with the problem, which decreases the feeling of helplessness and hopelessness. The identification phase is the development of a nursing care plan based on the patient's situations and goals.
All right, Sammy, after reviewing your health assessment, what outcomes would you like from this visit today?
I'd definitely like to be able to get back to work because I haven't been able to work since I got sick.
Okay, so it's affecting your daily life a lot.
Yeah.
All right, well, I want you to know my goal is to get you where you want to be, back to your daily living, and especially back to work.
Okay.
During the process and the treatment process, if you have any concerns, questions, or you're not fond of the treatment at all, let me know and we will change it specifically to you. And I just want you to know that your care is important to us.
Thank you.
The third phase is the exploitation phase. This phase uses professional assistance for problem-solving alternatives. The advantages of the professional services used are based on the needs and interests of the patients. In the exploitation phase, the patient feels like an integral part of the helping environment and may make minor requests or use attention-getting techniques.
Alright, so I do have one question. What would I be able to do at home to help fight off the flu?
What's really going to help a lot is mostly rest. Rest is going to be key to fighting off the illness. And then drinking lots of fluids. So be drinking about a gallon of water every day. And then just having a balanced diet is really going to help, because that's just putting good proteins and vitamins into your body to help fight off this illness.
Okay, and then can I also take the emergency drink as well?
Yes, that will be really good for this.
Okay.
It'll help.
The final and fourth phase is the resolution phase. This phase is the termination of the professional relationship, since the patient's needs have been met through the collaboration of patient and nurse. They must sever the relationship and dissolve any ties between them. This can be difficult for both if psychological dependence still exists.
How are you feeling at this moment, Sammy?
Definitely feeling a lot better. I think I'd be able to go home just so I can get some rest.
That's good. We talked about your goals in the beginning of the cure care. Do you feel like your goals have been met?
Yeah, I believe so.
Good. Okay. I feel like we've done a really good job here, and I feel like you know what you're supposed to do now at home.
Definitely, I'm gonna get some rest. I'm gonna drink as much water as I can, and then I'm gonna eat healthier just so my body can fight off the illness a little bit faster.
Perfect. All right. Well, do you want me to walk you out?
Yes, please.
Okay.
To understand more about Peplau's theory, here are some examples of its application in the healthcare setting.
Let me see if I can contact him and let him know that you have to speak with him. Okay. In the meantime, did you still need to get up to the bedside commode?
Yes, please.
Okay. Be real careful there. I know you might need to sit on the edge of the bed for just a few seconds before you get up. Oh, hold on 1 second there. Your IV's caught up on that side rail. Would hate for that to come out on you.
Me too.
Okay, so just be really careful when you get up.
Thank you for being so patient and helpful today.
You're welcome. No problem.
You know, they have a certain degree of respect that you have to give them. But even if they have dementia and they don't know their name, they still deserve the respect.
Thank you for watching. Bye.